Well, you're most welcome to this talk. It's Wednesday evening, the 26th of May. Some news from a couple of countries, the UK, the US and India today. But I just want to start off with a bit of context. So this is the graphs for the English-speaking countries, or the main English-speaking countries. So we see Ireland, New Zealand and Australia at the bottom. Australia and New Zealand, of course. Of course, the problem is the Irish aren't reporting their figures anymore. Unfortunately, this is not the real situation, unfortunately. Then the United Kingdom, where we've had this increase, largely driven by the Indian variant. Then the United States and Canada. But overall, we're getting a downward trend. Now, we don't know where Ireland is. We assume it's a little bit lower than this because the vaccination programme is carrying on. But the UK, levelish down and then up a little bit with the India variant. Now, more on that in a minute. We're not sure where that's going at the moment. Now, this is a few European countries just for orientation again. So the UK, the bottom there, then Italy, then Norway, Spain, France, Belgium and Sweden in terms of number of cases. And I think you would agree there, we're seeing gradual reductions in most places. Some are levelish, but pretty well reductions in most places, which is really quite encouraging. But of course, why is this? Well, vaccination's got a lot of adverse publicity lately. There are vested interests trying to discourage the vaccination programmes, but let me give you evidence that they are working. So there's the downward trends and there's the upward trends in vaccination. So we see the UK leading the way with vaccination and then this cluster of European countries behind. And basically the Europeans are about a month behind the UK, and there's no question in my mind that the relationship is causal there. It's the vaccines that have caused the cases to go down. Now, still concerned about India. So national level, India on a national level, it's declining. So if we look at the graphic for India, we do see a reduction in cases. But cases are still rising in Tamil Nadu, North India, Andhra Pradesh, West Bengal, unclear. Now, what's actually happened is like the populous areas like Mumbai and New Delhi, the number of cases there are going down, but that's where a lot of the testing was taking place. So I think we're probably missing quite a lot of cases at the moment, but let's see what other people are saying. So this analyst at Middlesex University, the weak rural surveillance complicates the picture. So we're not really sure what's going on in the rural areas, unfortunately. It's possible that total transmission nationally has not yet peaked, nor not peaked yet. Not visible in case numbers. Infection is mostly spreading now in rural areas. So perhaps the cases in India are more or less at level at the moment, is what is the sort of consensus of thinking here, because the cases are going down in the areas where there's most testing available in the metropolitan areas. And we know about 65% of the population of India lives in rural areas. So it's still a problem. And of course, these are the areas where there's least news, and these are the areas where there's least medical facilities, and therefore this is the area where most people are going to be dying often through lack of fairly basic care. I am afraid it's not over yet for rural areas. Cases and deaths still mostly linked in India. So throughout this pandemic we saw this, didn't we? We saw the cases, then 3-4 weeks later we had the deaths. We're not seeing that now in the UK because of the vaccination. Even when cases increase, we don't expect deaths to increase, but in India they are still linked, unfortunately. So these deaths will stay high in India. So that is the 4,000 deaths per day line there, and that's going to stay high for some time. It's going to stay at least high-ish for some time because of the baked-in cases from the cases that have already occurred. Now, United States, this is good. The cases are clearly going down. So these are the daily cases in the States there. 7-day moving average, just over 22,000. So that is encouraging. But what is less encouraging in the States is this is the daily count of total doses of vaccine, and we see it was at quite a nice peak there, over 3 million a day. Now it's down to just over 1.5 million a day. So the vaccine programme is rolling out in the States, but the daily numbers are down. And of course, this is just delaying everything. Let's hope it picks up. So United States, that's the cases. Deaths in the United States, worth remembering, 587,830 people have died already in the United States. This has been a bad pandemic. Vaccination Trends was that link is that screen there. And of course, there's lots of other things you can click on and get quite huge amounts of information. These sites are really quite sophisticated now. The UK one is as well. So one dose, now it will be over 50% having one dose, and 2 doses, 39, let's say 40% for that. But this is the whole population. These are percentages of the whole population. Adults with at least one dose, 61.6%. So the direction's good, but what is holding things up in the States in the vaccination programme is people just turning up to get the vaccines. So do encourage your countrymen, if you're in the States, to follow the national guidelines. Now, moving on to the UK. Again, I've put the link there for all this summary data, which is interesting. So 72.9% of adults, these are proportion of adults vaccinated in the UK, 44.8% have had the second dose. Huge amounts of fascinating information. Unfortunately, we see a rise in cases, 18% on the week in terms of cases. And patients admitted to hospital, we see an increase as well. Now, the overall numbers are still not massively high. But I was watching the news, and I believe in Bolton, with the India variant, there's about 52 cases in Bolton Hospital. Mostly people that weren't vaccinated. The vast majority, we are told, weren't vaccinated. But still, a pity to see numbers turning red. So increasing cases in the week and increasing hospitalisations in the week. Overall, though, we are dealing with relatively small numbers of cases compared to what we have been. That's the graph for cases. So it's just so flat there, though, isn't it? It's just been flat for such a long time, really, now. Healthcare, we'll look at that. We probably see a slight increase. No, it doesn't really show on there, does it? No, it's not really showing. So that's good. It does show that the overall numbers are small. And deaths in the UK, thankfully, are way down because of the breaking of the link. And we see the deaths well down there because of the breaking of the link as a result of the vaccinations. So Office for National... just before I was like, Nadu Sahawi, the vaccine minister, I heard him saying, well, when I heard him, I overheard him watching the House of Commons live on TV. Next year, the UK is going to produce 700 million doses of vaccine. So we've got a few new vaccine facilities coming online. One in Norfolk, one in Scotland, one near Oxford. And we're going to be producing 700 million doses of vaccine next year. Now, I can't imagine we're going to need more than one per member of the population. So that should leave about 640 million doses of vaccine spare for countries that aren't producing their own. Let's hope this happens. So massive increase in vaccine production in the UK. And this is going to happen all around the world because people have been realising that they've been caught without their own domestic vaccine production. Canada, for example. Office for National Statistics, week ending the 15th of May. Percentage of people testing positive in England, very low, 0.09%, indicating way less community transmission. So that is a pretty low percentage of people testing positive. Early signs of an increase in the north, east, Yorkshire, the Humber and south east. So again, India variant area, slight increase in positivity and cases. Should probably be crossed out there. But basically, the positivity rate is low. I mean, remember areas with high amounts of community transmission, we're looking at 10, 20, 30% positivity rates. even higher in some areas. Wales, it was 0.02, Northern Ireland 0.06, Scotland 0.05. These are indicating low rates of community transmission. Very encouraging. Positive rates are very low. So, trends difficult to identify. So what it's saying is, because the positivity rates are so low, a change of 2 or 3 will make a big difference to the percentage. So it's harder to identify trends, is what the ONS are saying there. Affected by small changes, yeah. So getting a trend week to week in terms of positivity rates is a little difficult. Now, if you live in the UK, you'll be aware of all the kerfuffles going on over the past couple of days. Let's just look briefly at what happened. Now, the India variant is increasing in 8 main areas, and these areas were told to avoid indoor meetings and unnecessary travel in and out of those areas yesterday. This all got politicised, unfortunately. Now, from the 14th of May, Bolton and Blackburn with Darwin had been in these areas, but now Kirklees, Benford, Burnley, Leicester, Hounslow and North Tyneside were added to it. But then today there was a bit of backtracking, and while it's still advisable to avoid indoor meetings, the government were just saying it's an advisory to minimise travel. But I just found it, the government made this announcement. Okay, it wasn't publicised that well, and it was done fairly quickly. But there again, in the government's defence, which I'm not because it's not political, but in the government's defence, when we announce things ahead of time, like we announced about 5 days ahead of time that flights were stopping out of India, then the flights out of India increased and thousands more people came in to miss the deadline. So you can kind of see it both ways. Yes, people need to prepare, but also if we give lots of warning, then that gives more time for spread to occur. But I just thought it was a bit pathetic the way it was politicised in the UK, with people making political points about how this should have had more notice and things like that. Whereas in the UK we've had less of this politicking about recently, but it's disappointing to see that it's coming in. Let's hope it stops. Let's hope the politicians are listening to this and stop politicking about with this. Anyway, a couple of good news stories to finish. Turin, Italy, Medical Association, 24th of May. They published this. 29th of March to the 2nd of May. Now, this was healthcare workers. They tested a group of 5,823. 97% of vaccinated healthcare workers couldn't transmit the virus. Pretty good news. 3-month follow-up by using PCR testing. They found the positivity rate was 179 of those. That's 3.7%. Now, the other 97%, of course, that didn't test positive, if they don't test positive, then they can't transmit the virus, because the PCR test will show the virus if it's there. So this is good evidence that fully vaccinated people are not transmitting the virus as effectively in Turin, in Italy, in a healthcare setting where people are exposed to the virus quite a lot. Is that likely to be essentially true everywhere? Yes, I believe it is. So the precise figures, 96.93 did not harbour the virus in the upper airways. Good. Even though they'd been exposed to it, presumably at work, the virus was not cultured from the airways. So that was the group that was tested, 5,823. Reporting group that just reported symptoms, 11,910. 168 of them reported symptoms, 1.14%. And they were subsequently tested and found to have contracted the virus after vaccination. So we are looking at very low rates of retransmission after vaccination in Italy. So another good news story, consistent with the reduction in cases that we saw on the graphics. Vaccination program's not perfect, but it is what is getting us out of this pandemic. I've been bombarded with emails pointing out how many people are dying and things. There's a lot of disinformation about the vaccination program. We have to look at the official figures. Now, we did look at that yesterday. We looked at cases of possible myocarditis after Pfizer vaccination yesterday. We've looked at possible adverse effects in thrombosis, thrombocytopenia after the Oxford AstraZeneca vaccine and the Janssen vaccine. But overall, all of the regulatory authorities are saying that the advantages of vaccine greatly outweigh the disadvantages. And it's a pity we don't have therapeutics as well, but there you go, that's where we are at. Now, last good news story today, Malta. Population, small island population, just under 500,000 people. Now, the health minister here has been mouthing off, this chap here, talking about vaccinations. First dose, 70% of the adult population. They must have got quite a few because the European Union country, of course. Second dose, 42%. Now, that's looking good. Vaccine open to all 16-year-olds. And the health minister says they've reached herd immunity. Now, I think he's being a bit optimistic. But I think there is an indication that they are certainly moving towards that. And the reason I'm talking about this is this is the way everywhere is going that's got good vaccination programs. There's only like 1, 2 or 3 cases a day. Test positivity rate still 0.2%, so higher than the UK. That's why I think there's a bit to go yet. They're going to skip mandatory outdoor masks from the 1st of July. And here's the graphic that shows this effect. So massive decline and very low numbers of cases. In fact, there's essentially no cases. So herd immunity should start occurring everywhere when we get to about 80% of people vaccinated. So Malta's been fortunate there. They're not quite there yet, but the direction is good, and that's where we're all heading. And we've looked at very positive data from Israel about this as well. But of course, poorer parts of the world with poorer logistics and governments that aren't as efficient and, well, to be quite honest, places where there's a lot of corruption, very low numbers of people vaccinated, and I really feel we are going to need to export vaccines and preferably vaccine technology to those countries, although the export of vaccine technology has been argued against by powerful people who you can probably readily find on other media channels. So a brief update today, mixed news. Things are still difficult in India, but heading in the right direction in Europe. The India variant really is a blip in England. I hope it's not going to be a big problem. There's cases in Scotland as well. It's a problem, but I don't think it's going to. I think the balance of probability is that we're going to maintain our roadmap in England and still open up more on the 21st of July. And if the price of that is some regional restrictions, then that may be necessary. But as the vaccination programme ramps up, and the good thing about this India variant, if there is a good thing, I think it stimulated people in these areas to really take up the vaccine at high levels. So I am optimistic about that. So there we go. As always, a bit of a mixed picture. Lots of other things I was going to do today, but I haven't had time to prep them. But we'll see how we go tomorrow. There are plenty of interesting things seem to keep happening. So, okay, thank you for watching.